Hi, I'm Rachel Glett. This is Fall Prevention and Skilled Nursing Facilities for Nursing 434 Quality Leadership. All nurses face similar issues no matter what specialty of nursing is identified. One issue nurses must work hard to address is fall prevention and the reduction of facility fall rates. As someone who works in geriatric medicine, falls are a huge factor among my patients and can even cause fatalities. Though eliminating falls altogether is not possible, fall reduction and reducing injuries caused by falls is an important task. Falls are something we should always screen older patients for because 1 in 3 elderly patients living in the community falls at least once a year. Since falls are so common, they are extremely costly to healthcare. Nurses can play a great role in the prevention of falls in a clinical setting and following discharges to home. It is also important to address fall prevention and reduction in skilled nursing facilities. Approximately 1,800 nursing home residents die each year as a result of falls. Going on, the CDC notes that the typical nursing home with 100 beds reports between 100 and 200 falls each year, and of those falls, 10 to 20% are associated with serious injuries. This presentation will discuss mission and vision statements, establish an aim statement, use a SWOT analysis to develop a plan to help reduce falls in skilled nursing facility settings. Mission and vision statements. Developing a mission and vision statement will establish a clear understanding of the goals, values, and plans of the project. A mission statement establishes purpose, describes the what and why of an organization, and is the foundation for strategic direction. The mission statement sets a clear foundation for an organization's goals, plans, and reason. Vision statements are different from mission statements. A vision statement explains more what the company would love to see or the company's vision of a world where their mission statement was fulfilled. In this case, the mission statement we could establish is healthcare workers assessing patients and implementing processes and education to drastically reduce the rate of falls in skilled nursing facilities. A vision statement for this project is a team of healthcare workers providing a safe environment for patients to thrive in without the setbacks of frequent falls. Finally, it would be important to develop an aim statement for the improvement project. This will set a measurable and attainable goal. The aim statement will read, in the next 3 months, the fall rate in the facility will decrease 50%. This will be the goal of the project. SWOT analysis. After establishing that in any organization there is constant opportunity for improvement, especially in healthcare, providers should identify ways to improve on weaknesses and use strengths to adapt to changes. A tool useful to making such changes is a SWOT analysis tool, which is a confrontation between external developments and internal capabilities. External developments are identified as either opportunities or threats for the organization. Internal capabilities are described as strong or weak points of the organization based on the confrontation between the two. Strategic options or even new strategic course can be identified for the organization. In this case, the strengths, weaknesses, opportunities, and threats relating to decreasing fall rates in skilled nursing facilities are listed on the table shown on the slide and listed on the final page of the transcript. Beginning with strengths, we can note excellent patient outcomes. This indicates that we are currently moving in a good direction with successful care, rehabilitation, as well as dignified care for long-term residents. Low antipsychotic numbers are another strength that should be identified in the prevention of falls in the elderly. Medication-related falls are a risk factor that must be addressed. Pharmacological factors that place the elderly at greater risk of drug side effects include changes in the body composition, serum albumin, total body water, and hepatic and renal functioning. Drug use is one of the most modifiable risk factors for falls and fall-related injuries. Fall risk increasing drugs include drugs for cardiovascular diseases, benzodiazepines, antidepressants, antiepileptics, antipsychotics, and antiparkinsonian drugs. Psychotropic and benzodiazepines are most commonly associated with falls. Moving forward, the facility is already alarm-free, which is almost unheard of in many places, placing the facility at an advantage. Alarms have been proven to increase falls, increase confusion, and anxiety among the elderly, and have limited effectiveness in the reduction of falls in skilled nursing facilities. It is also important to identify weaknesses that must be addressed when implementing changes. Understaffing is a huge problem in many places of healthcare. That is not something that is easily fixed, therefore, it will definitely take creativity to work around this issue, which we will discuss later when we identify who is involved in the improvement plan. Another difficulty is patient compliance and the plans we put in place for them. We must also consider patient dignity as a huge factor in the prevention of falls. Dignity is often hard to maintain while keeping patients with severe cognitive impairment safe, but must be considered when caring for such residents. Another challenge would be to teach staff to change the methods that many of them have been practicing for decades. Opportunities and threats are also significant concepts in decreasing fall rates. Changes to improve patient-centered care can present large opportunities to decrease fall rates in skilled nursing facilities. Education programs for staff and families and involving both parties in the planning and implementation of new methods for fall reduction can also be a great opportunity. Another concept that is of utmost importance is making fall prevention multidisciplinary. There will also be threats that arise to the success of the new plans, such as understaffing, budgets, costs, state regulations, and moving staff and families from an old school mentality of chemical restraints, physical restraints, and alarms as the only methods of fall prevention. Overall, preventing falls is crucial, especially in the geriatric population. Historically, nursing facilities use physical as well as chemical restraints to keep people from falling and endangering themselves. As time moves forward, there is a demand for the removal of both from geriatric care. In many facilities, chair alarms and bed alarms are still used to alert staff of patients who are at risk for falling. In my facility, we are 100% physical and chemical restraint free as well as alarm free. We have made exponential gains at reducing falls and falls with injury, but still have room to achieve more. There are many opportunities to help staff develop better methods and routines to treat patients with autonomy and dignity while keeping them safe. There is much room to teach and grow both staff and families to help prevent falls and enrich the lives of the elderly that they love and care for. Who, what, and how. The prevention of falls in the elderly requires participation from all people involved in the care of skilled nursing patients. From the executive director of the building to the nurses, certified nursing assistants to the housekeepers, all people play an equally important role in keeping residents safe and free of falls. With the goal set to decrease the facility's fall rate by 50%, all employees have a task at hand. Once the team has identified strengths and weaknesses of their current state, they are ready to develop a plan and to continue to grow. The team can start by identifying ways to become more engaged with the residents at high risk for falls. For example, the nurses' aides can host an activity with patients while they do their charting in an area where residents are visible to them. Nursing therapy and other staff can take patients for a walk to see what is going on another part of the unit, allowing them to stretch their legs and get up from their chair in a safe, controlled environment. Housekeeping staff can alert nursing staff of patients' needs and be an extra set of eyes for those who are at risk of falls. Cleaning up spills and wet floors in a prompt manner can also help prevent falls. Keeping the unit and bedrooms clean and free of clutter is another way to assure patient safety. Staff working in the office will be assigned 15-minute blocks of time during each of their days that they will be required to leave their office and go onto the floor. During this time, they will visit with the residents and offer support to the floor staff in order to help engage residents and allow nursing to complete other tasks. Community life staff will identify each individual's desires, likes, dislikes, and work with all disciplines to help provide an individualized care plan for each resident in order to decrease safety risks that may arise. Leadership skills will be important to make this process work. Working as a team using principles of shared governance and a faith-based foundation can create several improvements in the care provided by a healthcare team. When people feel they are accountable and important aspects of the place they are employed by, and invaluable pieces of the care that the patients receive, they are willing to work hard and create care they are proud of. The idea of shared governance requires workers who are driven by reasons other than just a paycheck. It also requires accountability. People working together must be accountable for their own actions and hold others accountable to work hard to meet a common goal. There are places in the Bible where we are taught accountability, to work together for a common goal and pull our own weight. It is taught to us to hold others accountable in Matthew chapter 18, verse 15. We are taught to respectfully hold each other accountable for our actions. When using shared governance in the workplace, workers who have a passion and commitment to serve the Lord, as well as other children of God, are excellent assets to a facility. It is important that employers educate those they hire on the principle of shared governance and faith-based care. These are the references I used to create this presentation. Thank you very much for your time.